A hair transplant can fail, even when the surgery is done perfectly. Not because the doctor made a mistake, not because the technique was wrong, but because of things most patients never think about. Today, I'll show you the two biggest reasons this happens. Hi, I'm Dr. Ko, a hair transplant surgeon in Korea. Many people believe a bad result always means bad surgery. But that's not always true. Sometimes the surgery is excellent, yet the result still disappoints. Let's talk about why. The first reason is what happens after the surgery. A transplant doesn't end when you leave the clinic. For the first 1 to 2 weeks, the grafts are trying to connect to a new blood supply. This is the most important healing period. Your body has to keep those grafts alive. But many patients accidentally make it harder for them to survive. Smoking is one example. Nicotine narrows blood vessels and reduces blood flow to the grafts. Alcohol can increase inflammation and slow recovery. Heavy exercise too soon can raise blood pressure and cause unnecessary stress to the scalp. Even poor sleep can interfere with healing. So here's the key idea. The surgeon places the grafts, but your body keeps them alive. If the healing environment is not good, even perfectly placed grafts may not survive as well as they should. The second reason involves the crown. Many patients expect dramatic improvement there. But the crown is actually one of the hardest areas to transplant. Hair in the crown grows in a spiral pattern. The angles constantly change. The scalp is often thicker. Because of this, it's much more complex than a frontal hairline transplant. There's another issue too. In the crown, many patients still have some existing hair that is slowly thinning. So even after transplant, the improvement may look subtle at first. And if someone is not treating their ongoing hair loss with proper medical therapy, the surrounding hair can continue to thin over time. When that happens, the transplanted hair may remain, but the rest of the hair becomes thinner. This can make the crown look uneven or patchy. And patients sometimes think the transplant failed, but in reality, it's often the natural progression of hair loss. So, if a hair transplant result feels disappointing, it doesn't always mean the surgery was done poorly. Often, the real reasons are healing conditions after surgery and unrealistic expectations about the crown. Hair transplantation is not just about the operation. It's about surgery, healing, and managing future hair loss together. If you're thinking about getting a hair transplant, understanding these factors can make a huge difference in your final result.